Public health providers in Hamilton County are speaking up today about how to fight the opioid crisis.
And joining us now with why they say they all need a history lesson is medical reporter Liz Bonus. Liz.
Hey guys, good afternoon once again. Good afternoon to you. Now this all has to do with the money that we expect to hear more about from settlements that are expected to come from lawsuits. Those of course have been launched now against pharmaceutical companies in Ohio and across the country. The health commissioner in Hamilton County said today that opiate settlement funds belong at the local level and they shouldn't just be given to the state with no plan for distribution. Tim Ingram told me today that we learned from Big Tobacco that if you don't create regional foundations to address what's needed in the area, the money won't get to those families who are struggling and the numbers of those dying from addiction won't go down. He said we messed up years ago with Big Tobacco settlements and didn't distribute the money appropriately at the local level. And as a consequence, smoking rates here and in Ohio are still higher than in much of the rest of the country. He says each community needs to have it go towards its own needle exchange programs, addiction treatment programs, and much more.
That let's take the lessons learned from what worked and what did not work with the Tobacco Use and Prevention Control Foundation created by the state legislature. But this time, since I was a member of that for years, really from the beginning to the end of its, toward its unfortunate demise, let's go ahead and create regional foundations because Ohio's demographics and geography is so diverse. And let's not put all the money in Columbus. I realize Columbus is going to have some of the money, but let's make sure a lot of this money goes to who it's intended, and that is the people who are suffering from the diseases of addiction.
Now it's interesting, the money hasn't come out yet, so it's a smart time to have this conversation. Right. And he didn't say each region should get the same amount. For example, Hamilton County might have more than Brown County, but we each know our own communities, and that's really his point. His statement is very interesting. I put it on my Facebook page if you want to go check it out. But I just think he's inviting a conversation that we waited too long to have. And once the big people, I say the big people, the people at the top of the state start saying, oh no, it should go to us and we know best for you, sometimes that doesn't work.
Well, it makes sense to have that money allocated based on need in the different regions.
And who knows our need better than those of us that are here.
The conversation's really been changing lately too, where this started and what we need to do.
Well, and I think that's a really important debate because while we do want to sort of blame someone else, pain is something that should be treated. And so we can't stop the conversation at, hey, it's your fault, you gave us too much pain medication. The right people should be treated for pain, the right people should be treated for addiction.